Welcome to the SASH Emergency Department. Our facility operates much like a human emergency department. On arrival, please check in with our team. You will then be seen by one of our highly trained triage nurses. The triage nurse is an expert at making an initial assessment based on your pet's current condition and assigning the priority in which they are seen by the emergency vet. The emergency department does not operate on a first-come, first-served basis. Instead, the most life-threatening cases are always seen first. The triage nurse can provide you with an estimated wait time on arrival. However, this may change depending on your pet's condition and the presentation of very sick or injured patients. After triage, there may be a wait before seeing the emergency veterinarian. It can be difficult to wait, especially when you're worried about your pet. A long waiting period can be a good sign that your pet does not have an immediately life-threatening condition. If your pet's condition changes during the wait, please let a team member know. If your pet is triaged as having a critically urgent condition, we will ask your permission to perform emergency treatment and stabilisation. Please be patient with our staff. They will communicate with you about your pet's condition as soon as they can. Sometimes the waiting room may appear quiet. However, this does not always reflect the caseload that is being managed behind the scenes. Here at SASH, we have a highly trained team of vets and nurses who just treat emergency outpatients and look after critical inpatients. Your pet will be seen by the emergency vet, who will explain a number of things to you, including the diagnostic and treatment options and an estimation of costs. If you are concerned about finances, please let us know. There are a number of payment options that we can help you with, including insurance, gap only, and a number of external payment plans. Depending on your pet's condition, the recommendation from the emergency vet, and your own personal preferences, your pet may be discharged to return home or be admitted into hospital for further treatment and care. If admitted into hospital, your pet may be seen by a member of another specialist department. For example, a surgeon may be called in to perform immediate emergency surgery. A specialist department may take over your pet's care at a later date, following stabilisation through emergency. Internal referral to other specialist departments is not always appropriate, but we will always do so when medically necessary. If discharged, the emergency vet may recommend an appointment for referral to see a specialist at a later time, or for follow-up at your regular GP vet. You will always be provided with discharge instructions that will summarise the diagnosis, treatment and plan. We will send a copy of your pet's medical record to your local veterinary hospital so that they can continue to provide the appropriate ongoing care. If your regular vet has changed, please let us know. Presenting to the emergency department with your beloved pet can be a stressful time for you and your family. We are here to help. Please treat everyone with respect. Thank you for choosing SASH. We are committed to providing gold standard veterinary care and helping pets and their families live their best lives.